What are some of the low-risk mutations in MDS?
The nice thing about MDS is there's only one mutation that is considered truly a low risk mutation. That's SF3B1. If you have that mutation, those patients have a very specific disease characteristic. They generally have isolated anemia. They have ring sideroblasts in their bone marrow. And those patients tend to respond really well to, red blood cell stimulating agents. They respond to luspatercept. And a lot of those patients we observe for many years, even prior to even starting these therapies. So that is, the main low risk mutation that we have.
What are some of the high-risk mutations in MDS?
Outside of that, the rest of the mutations are, primarily high risk, and then we have, a lot of mutations that, are either controversial on what their risk looks like, or is kind of somewhere in the middle. And I think, the highest risks mutations are TP53 that I mentioned, ASXL1, another very high risk mutation. I think those are the main ones that you really want to focus on, because those are, the ones that I think, have therapeutic implications as well. So with SF3B1 being sort of our low risk disease subset, TP53, ASXL1 being the primarily high risk mutations, and then everything else sort of falls somewhere in the middle. We do know that if you have additional mutations, so even if you have a good risk mutation, if you have 5 or 6, mutations in your blood, that is going to predict a worse risk than if you have, one mutation in your blood. And so the more mutations you have, the more your disease, it kind of has had a chance to evolve and change and become resistant to certain therapies. And thus, leading to an overall, generally a worse outcome there. And again, those are the patients that when I see in clinic, I'm really trying to direct to, okay, you might be doing well now, but let's start thinking about clinical trials. Let's start thinking about transplant, seeing if you're eligible, so we have that available when we might need it later.
Yeah, so there's a lot of controversy in this area. However, there are several mutations that are associated with higher risk in our MDS patients. Specifically, these mutations are TP53, IDH2, ASXL1, CBL, and DNMT3A. So these mutations generally have been shown to be associated with a poorer prognosis for patients who have MDS. Also, mutations in TET2 and SF3B1 have been associated with a better response to hypomethylating agents like azacitidine or decitabine, which are the drugs that we often use to treat higher risk forms of MDS.